With Dr. Chandler Park at ASCO GU. We were wondering which RCC abstracts you're most looking forward to at the meeting this year.
Yeah, this is going to be an exciting meeting for kidney cancer at ASCO GU 2026. There's going to be 3 studies that I'm going to be looking for. 2 of them has the potential to be practice changing. The first one is going to be the LIGHTSPARK-011 study. Standard of care is immune checkpoint inhibitor, whether with a TKI or doublet therapy with nivolumab and ipilimumab. So then the question becomes, what do we do for second-line treatment? So there's a lot of treatments available, but there's no prospective study head-to-head. In this ASCO GU, we're going to be looking at belzutifan, a HIF-2 alpha blocker, with lenvatinib versus cabozantinib. And so we're going to have study results on this. Primary endpoint was PFS. We're going to be looking at the PFS, but also we're going to look at the toxicities. What's going to be the difference in terms of grade 3 toxicities with each arm? Now, the other one that's going to be, I think has the potential to make huge waves is called the LIGHTSPARK-022. And so the LIGHTSPARK-022 has to do with our patients with high-risk renal cell cancer. This is T2, grade 4, maybe sarcomatoid, T3, also T4 M1 NED. And the standard of care is based on the KEYNOTE-564 study that showed an overall survival and a DFS versus placebo. So to build on that at this year's ASCO, this is going to be LIGHTSPARK-022, where the comparison arm is going to be pembrolizumab, 200 milligrams for every 3 weeks for a total of 1 year, versus pembrolizumab with belzutifan, the oral medication that we're all familiar with. So this is the primary endpoint is going to be DFS, and we're going to see some signal here. We're going to also look at the toxicities. What is the anemia going to look like? What's the hypoxia going to look like? So this is going to be the highlights of not only just on the renal cell session, but also in terms of the whole ASCO GU. Now, the last thing that's going to be very interesting is our good friend, Dr. Chad Tang at MD Anderson, one of the bright leaders in the field. He's going to be presenting data on, it's called the K-COMPASS study. And the K-COMPASS study has to do with SBRT for patients with oligometastatic disease. But you also look at KIM1, kidney injury molecule 1. And so he's going to show us KIM1, ctDNA, and the role of SBRT of using targeted radiation, kind of like a gamma knife, for lesions, 5 lesions or less, for our patients that have oligometastatic disease. So it should be an exciting meeting for kidney cancer, and I think this is going to be one of the headliners for those sessions.